Good morning, everybody. My name is Dr. Akua Owusu-Dommey, and I'm a new general dentist. Today, we will be discussing Bruxism. This is your health. Now, Bruxism is a big word for those of us who aren't in the dental field. But if you're common with the terms of clenching and grinding, you know what Bruxism is. Bruxism is an umbrella term grouping together different motor phenomena of the jaw muscles, including teeth grinding, teeth clenching, bracing, or thrusting of the mandible, which is your lower jaw. This is called a parafunction, and parafunctions are things that your jaw does or your mouth does that are opposite to how your body was designed to work. Now, historically, classifications and definitions of bruxism have varied widely, and nocturnal, which is at night when you're sleeping usually, and diurnal, which is during the day when you're awake, bruxism is common across U.S. adults. And like I said, grinding, clenching, all of it is coming from the same etiology. So classical bruxism activities are clenching and grinding. However, there's an emerging consensus that bruxism may involve chewing activity without tooth contact, if that makes sense. So for example, bracing describes forcefully maintaining a certain mandibular position, and thrusting describes forcefully moving the mandible in a forward or lateral direction. Either way, all of these things are a parafunction of how the mandible should articulate with the maxilla, which is your upper jaw. And so a lot of the reasons for your bruxism will mostly depend on things of your central nervous system, like things like stress sensitivity, emotions, personality features, sleep regulation, and your automatic nervous system. And so that's giving into your sympathetic and your parasympathetic things that are going on. Sometimes you can brux or clench in a fight or flight mode. Sometimes you can brux or clench when you're trying to regain a little bit more control over your environment. So it's definitely a whole body thing that contributes to bruxism. In healthy individuals, bruxism can be considered a muscle behavior, which can be harmless or represent a risk factor rather than being a disorder per se. And treatment needs depend on the presence of clinical relevant consequences rather than just the bruxism itself. So basically what that means is that you can brux and grind, but if you're not causing teeth damage, it's not necessarily that big of a deal. Unfortunately, for most Americans, bruxing and grinding will lead to teeth damage and will lead to chipped crowns, will lead to broken crowns altogether, pain in your teeth when you wake up, or all of the things that you don't want to go to the dentist for. Sometimes that can occur as a result of bruxing and grinding. Like I said before, bruxing can result in tooth wear or cracks, fracture of dental restorations like fillings or crowns, implant failure, muscle hypertrophy, pain and fatigue in jaw muscles, headaches, toothaches, disturbance of bed partner sleep, and reduction in overall quality of life. And so sometimes when you wake up and you have a headache, sometimes that can be due to bruxing at night and you didn't know it. Now, treatment is symptomatic and you have to kind of manage it depending on the patient and what they're able to handle. So management options include oral appliances like a mouth guard. Sometimes you can do cognitive behavioral approaches like therapy, psychotherapy, physical therapy, and sometimes you can also use relevant drugs for short-term use like gabapentin, all of these things, muscle relaxers, or even sometimes dentists will administer Botox therapies to some of your muscles and mastication to make sure that you're not overly grinding at night. Treatments of any of these conditions associated with bruxism should be optimized, and we also need to know that bruxism can be self-limiting. It can be improved by improving your sleep hygiene, making sure you're not overly stressed when you're going to bed at night, and also trying to be conscious of it in the day. That when you're feeling stressed and upset, you're not clenching your teeth in response. You're finding ways to manage your stress and upset in other ways that aren't damaging your teeth. And so as a dentist, how will I be able to diagnose a patient with bruxism? I might be able to diagnose them by, asking them or their partner, are they hearing grinding noises at night? Is there tooth wear or soreness when I'm looking at their teeth or their x-rays? Are their jaw muscles feeling sore? Like I said, again, headaches, tooth hypersensitivity, and fracture of dental restorations can also be an indicator of bruxism. And then that can lead to worse things like abfraction, or lots of things can happen to your teeth because of bruxism. And so risk factors for bruxism include smoking, stress, snoring, and other medications. And so personal experience with bruxism So me, myself, like I said, I'm a new general dentist. And so I graduated dental school in May. And dental school was probably one of the most stressful times of my life. And I would find myself, me, a dentist, doing the very thing that I tried to tell my patients not to do, which is brex and grind. And sometimes I would wake up, especially in the period that I was studying for boards, I would wake up, my jaw would be sore, I would have a headache and all these things. So that was definitely kind of a, the healer needing to be healed myself. And so one of the things that's been helpful for me is getting a mouth guard. And a mouth guard just prevents my teeth from occluding in a parafunctional way when I'm sleeping. And it also, I even when I'm stressed, I still find myself doing the same muscle habits because it's a hard thing to extinguish. But with the mouth guard at night, you're not causing the same damage that you would if your natural teeth were occluding against each other. And then additionally, like I said, bruxism can present in the day or when you're sleeping at night, which is a little bit more autonomic. And so in the day, what you can do is try to, take deep breaths, count to 5, all of the things that you want to do to manage your symptoms psychologically instead of, pressing your teeth together and clenching, because overall, the stress of bruxing and the stress of clenching your teeth will lead to more stress along the road when you have to get tooth repair and all of these things. So definitely, I think it's important for a lot of U.S. adults to look into getting mouth guards because a lot of us brex and grind at night, and then also find stress management techniques for the day. Thank you for attending this Your Health podcast. My name is Dr. Akua Owusu-Dommey, and I appreciate you joining me for this lecture on bruxism.